All right, as people join, I'm going to get us started. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry update with Boulder County Public Health. As you saw from an email from me, we had a major change that's going to be happening as of tomorrow, and that will be described by Lane in his presentation. And there are some dates that come along with that. So I want to first off thank Boulder County for giving us some dates to look towards and metrics to look towards, so that when we're talking to businesses, we have a better sense on what the future might look like if we hit certain metrics and what those dates are. So I think 1 year in, we're finally able to kind of put some dates, some clarity on what the future could look like if our metrics hit a certain level. At this point, though, I'm going to lean it over to Lane to actually do the update. I did get a bunch of questions in email. I will ask those. If you have other questions, put them in the Q&A, and we'll see what he can answer today during this session.
Thanks, Corinne, and thank you all for joining. We'll run through a very similar agenda as we have for past weeks. And with an EPI update, we'll talk about where the state dial is going and the new county public health order, a little bit about 5-star, and definitely plenty of time for questions and hopefully as many answers as I can provide. So as of today, we are in yellow, but with our new public health order effective tomorrow, we will be moving to blue. So the metrics that I'm going to show you are really kind of, today's going to, for the most part, be the last day we're really looking at these metrics, and then we'll have a new metric that we're really going to be focused more heavily on. So for what we've been tracking, case counts, case incident rates, we're still pretty solidly in yellow. It's dropped a little bit from where it was last week. We were about 172, 173. And it's kind of bounced around a little bit this week, but has come down a little bit, which is still a good sign. Our positivity has dropped from where it was last week, so another good sign. But as you see the kind of multicolored slide that I have up, you know, we're pretty inconsistent around the state and certainly in those counties surrounding us on where positivity is at. So overall, state trends are still not super favorable. We did drop from 5.3 last week. We were at 4.8, I think, yesterday, and down to 4.6 today. So that's favorable. Hospitalizations, though, are not doing as well. I mean, we've been bouncing in this yellow area. We were about 11 days out last week, and now we're down to 7 days of decreasing. So this will still be something that we do keep watching, but we have another modified metric specific to hospitalizations that we're going to be tracking. Here's that graph of our case counts throughout time. You see the significant spikes when we had major kind of outbreaks, and then we have kind of this last surge in the last few weeks, and that has tapered off. So hopefully, again, we're moving out of that surge. Breakdown across our county, municipality-wise, a little bit of a reduction from where Boulder had been, and again, you see that overall drop from where we were previously. Now more representative, Longmont and Boulder, very similar. 106 cases in Boulder, 188 cases in Longmont. Lafayette, Louisville, and Superior at 64 cases. And then our other municipalities in unincorporated county are 68 cases. The, again, disparity tracking that we continue to do, still seeing that present in the last week or so. There was an uptick, so a little bit more increase in cases among the Hispanic Latinx community. Again, not to where we were a few months back, but again, a little bit of an uptick from where we were a week ago. That social distancing that we've been talking about now for several weeks, which is again that measure of how active people are, how much they're outside of their homes based on tracking their mobile devices. Still seeing that be a concern. So more and more activity. Again, from where we were, you can see last year as we moved out of lockdown at 82%, 41% in July, down to 29% in October. And here we are, Colorado at 6% in the last 2 weeks. We've been at 11 and 13% in the state, and then 11% in Boulder. So again, just continuing to drop, which again has explained a lot of that recent surge in cases. We are at, and actually this didn't get updated because I just updated it again this morning. So we're actually over 150,000 now, 151,000 people with at least one or multiple doses of vaccine. So that is great. That is over 55% of our eligible folks. So again, that continues to go well. And again, here's the breakdown across our age demographics, looking specifically at those where we initially started in earlier phases of the 70 plus down to the 60 to 69, 50 plus. You can see we're seeing pretty high percentages there, which again is why we're starting to move into this phase of further and further relaxation of our orders. We do still see those disparities. I shared this last week, and it's still present within those high numbers of folks vaccinated within those age demographics. We're not seeing the equivalent for many of our disparate populations. And again, we continue to track now that everyone 16 and up is eligible. We're looking at those areas and sectors where we have concerns. This is something that we'll continue to track and to continue to put emphasis and work on. There is sort of an issue based on tracking people by their address. So you can see that white dot, which really is honed in around the CU campus. So many of our students do not have Boulder addresses. So that does throw the data, really messes with the data considerably, given some of those challenges. Vaccine phasing. So again, just as a reminder, everyone is eligible at this point. So if you have not pursued getting an appointment, you really should. This is definitely what we need to continue to move in the direction we've been moving. So here's the resources we have at the state level. So again, the state website for vaccination information, as well as the state's hotline. So just again, summarizing all those key takeaways, what we had, still seeing our case numbers have been elevated, but they are decreasing from where they've been. We've seen a little bit of a drop across most of the age groups, which again is positive. The biggest concerns really are our kids, specifically, those that are not eligible for vaccination. So 0 to 9 and 10 to 17, still seeing increasing cases there. A lot of outbreaks, especially associated with sporting events, sporting teams. Still seeing our disparities within the Hispanic Latinx community. Again, good news, we are now over 55% of our eligible county residents vaccinated, so that's great. And again, all those higher risk age demographics have very high vaccination rates. But we still do see disparities in those age groups, so that still continues to be a target. Overall, our testing numbers are still down from where they had been, and positivity did drop a little bit, but still is much higher than it was as we began the year. And a lot of that is likely our time spent at home continues to decrease across the state and Boulder County. So just a reminder, this isn't new, but it still might be stuff that people are grappling with. Our Boulder County mask order was changed. It is specifically an indoor mask order now. There is no longer an outdoor component to it. Otherwise, all indoor settings, unless there's specific nuances that were prescribed to be allowed, where you're alone in indoors, you don't need a mask, or if it's a procedure that requires people to take masks off that were previously allowed, those things still exist. But otherwise, people need their masks indoors. Outdoors, it's still incredibly important when you can't socially distance to wear masks, but it is not required. All right, the big changes that Corinne had mentioned. So starting tomorrow, the governor is expected to sunset all of the state dials and then turn those into guidance for locals to implement local orders. And our Board of Health has already done that effective Monday night, they passed a local order, which will move us to the blue status starting tomorrow. And it will follow the dial as pretty much we had before. There are just a few notable exceptions, but I'm going to walk through all the dial pieces just so everybody has a reminder, since we have not been in blue other than those 5-star businesses. So 6 feet of distancing still is the driver in the blue dial status. And I know for restaurants that still is the limiting factor. While it does say 100% occupancy, 6 feet between dining parties is still that limiting factor. But for all activities, all businesses, 6 feet of social distancing is still the rule of the day. For indoor personal gatherings, this is where our local order has more stringent components than from what the state had done. So that is limited to the CDC recommendations for limited persons, which is defined by our order as 10 or less people. Then back to restaurants, mentioned the 6 feet already, but a last call is 2 a.m. for all those facilities that have liquor license. Smoking lounges are allowed to operate at 50% capacity or up to 25 people. Non-critical manufacturing, offices, retail are all at 75% capacity. Bars are at 25% capacity up to 75 people. Again, those 6-foot social distancing are kind of your guides for all those types of businesses. Gyms are set to have a need still that 6 foot of separation, but again, no set occupancy beyond their ability to have manage that. For camps or other group sports, indoors you can have 25 participants, and outdoors you can have 50. Personal services, limited healthcare are at 50% capacity or up to 50 people. Indoor events, we have the breakdown depending on whether it's an unseated event. So again, where people are moving around, mingling, have activities where they're moving, that is limited to 50% capacity or up to 175 people. If it's a seated event, now you're strictly limited based on your ability to have that social distancing. So again, between family groups. So, and then whatever the capacity of the room to allow that. For outdoor events, there is no cap. It just, again, needs people to be able to have that 6 feet of social distancing separation. But if you're planning anything that's going to have over 500 people, it needs to be submitted for review to public health. So you will submit that to our COVID Biz email that we've been sharing on all these webinars, and we will review that with the ability to veto that event if we feel that what you're proposing is going to be too great of a public health risk. So overall next steps. So this movement, this public health order takes effect tomorrow and it goes for a month. So on May 16th, if everything is tracking where our hospitalizations don't reach levels that are of concern, and I'll go into more of that metric and where you can track that metric. And we really have not seen this since our November surge. So that's the only time we really crossed the metric that I'm going to share about hospitalizations. So we do not have a lot of concern where that's going to happen. So from May 16th, we would be in clear. And so as long as that stays in effect through kind of August 16th is kind of that trial period, if you will, we will stay in clear. And what clear means is, aside from any mask orders that might still be in place, there will not be any restrictions on operation of any businesses or any sectors. So it really would just be about making sure people are encouraged to socially distance, and then we may have an indoor mask component that's still in effect. The exceptions would be childcare, schools, camps. Those may have additional components given that those populations will still be serving our kids that will not be vaccinated. So, but all other businesses will likely be in a situation where they will not have any more public health order requirements to meet. So what is the metric that we're going to be tracking to make sure we don't exceed? And that is really looking at our hospital admission rate. So that, and it's a kind of a 14-day moving average, but we're looking at specifically those hospitalizations that are happening. So this scale is very small. This is from 0 up to 3.5. And so the top line is the Denver metro area, and you can see Boulder overall has always done better. We've had, I think, better efforts, better controls, than what we've seen metro wide. We also have different populations, so there's a whole number of host reasons why. But anyway, we have tracked better than overall metro area. But the only time we exceeded this 2.0, which is now our new rate that we're going to be tracking to stay in clear, was when we had that surge in the fall in November. So even the surge early on in the pandemic, we did not get up to 2.0. So here's where we're at. And if you remember, this hospitalization falls very similarly to our overall case counts. And you remember we had that big spike, then we came down, we had another spike at the beginning of the year, and then we've had some of our recent spikes that we're coming down from. So you can see we're well below that threshold. We're well below even 1 per day. So we do not expect that we will have any kind of surge that jeopardizes our hospital system at the level of 2.2 cases per day. So that's, I think, good news. And there's no crystal ball, but really do not expect to see anything like the conditions we had in the fall. So we're pretty certain that there will not be anything that jeopardizes that timeline and plan. With that, we'll take a little break on that before we jump into questions. But Corinne, anything you want to share on 5-star? I don't know. I didn't actually put the new slide, but I don't know if there was a whole lot different.
We actually have 62 businesses now that are 5-star certified. We were able to get put into the public health order the maintaining of the 5-star program within the counties. So even within the different counties that now have public health orders, the 5-star program was maintained. We do have a question as to whether, as of tomorrow, 5-star businesses can start operating in clear, because technically under the 5-star program, we've communicated that you get to operate 1 level higher than what the county is at. That is going to be an administrative committee decision that it will be made this afternoon, and we will communicate with 5-star businesses. We'll communicate with 5-star businesses at that time. There is no more green in the public health order, so we're going to have to make a decision today as an administrative committee as to what we will do as 5-star businesses. Other than that, again, it is still an operational program. We are still taking applications, and then today the administrative committee is meeting at 3:00 today to decide under the new public health order what we will be doing as a county. Do you want to add anything to that, Lane?
Nope. So we'll have a decision by this afternoon. All right. And with that, just again, those reminders of the resources that really do aid in tracking disease. And if you haven't done this, please do think about adding this app. It is an important and useful tool, especially as we move into relaxation of our orders and people are not still fully vaccinated. And we're still seeing strains of concern in the community. So our 1 o'clock, we will definitely reflect on this as we move into this next month, given that we will not have a lot of changes. In fact, there will not be any more changes to the order for the next month because we are in control of that now. So we will not have any, barring again, the state putting a more stringent order that we would now have to follow. But we do not expect that to be the case. So we will definitely reflect on how much questions and concerns there is from the community. But as of right now, we'll still keep the schedule until we sunset it. But we do not have a Friday session scheduled this week. And then the Spanish language session is pre-recorded and should be released today. And all of those recordings are available on the Chamber's website. As I mentioned, for events, but other questions, concerns, and complaints, you can still send those to our COVID Biz email, as well as contacting the call center. Also, the call center is a great resource for folks needing support with setting up vaccinations. And Corinne, we can move to Q&A.
All right, so I think there's a lot of confusion as to what clear means. I think, will we still have to do 6-foot distancing? Is that just recommended? Do we still have to take temperatures? Do we still need to do clean surfaces? Is it still prescribed that we have to do this? Our performers still have to stay 25 feet apart? Clear means, other than mask orders and some guidance on make sure that you continue to clean and be as safe as possible, there will be no restrictions on those types of items, correct?
Correct. We would still encourage you where you can do many of those best practices that we've been doing. They're still going to be encouraged. None of those are required. So all of those things that we've looked at by sector, by color, all of that is going away. The one exception will be we probably will have some level of mask requirement still for indoors, but that will be decided at the beginning of May. So that would kind of be the only potential continuation is requiring masks.
And the mask order is separate from the dial order, correct?
Correct.
Okay. Because that's another question that came in. So, things like symptom checking, those are great things to do with your employees, even as we're moving forward with COVID, but there will not be a requirement to do some of the pieces that are in by sector. You need to do this. You have to take reservations. You have to, all of these little details that have been in these orders for last year. And I think it's confusing for businesses because we've gone from very, very, very detailed to, guess what, May 16th, mask. And we're going to go to a trial period of you don't have any restrictions. We would really hope you follow these best practices.
Correct. And I think, as a business owner, if you have vaccinated employees, once we're in the clear, it doesn't make sense to keep doing the same tracking for symptoms. But if you have unvaccinated employees, you still can have outbreaks. Because we're in clear, it doesn't mean people who are unvaccinated are still not able to get sick or spread disease. And there have been breakthroughs for people who are vaccinated. So it doesn't eliminate the vaccine. We're just at a different risk within our community, especially for overwhelming our healthcare system, which really has been the driver for why all these restrictions were put in place. As much as we like to eliminate disease, it was never a goal of preventing everyone from getting sick. It was spreading out disease so that the healthcare system never gets overwhelmed and really shuts down, our whole world.
Which leads to a question: is the hospitalization metric the only one that influences if we do or do not go to clear? What happens if our positivity rate dramatically increases, or our number of cases dramatically increases?
So they're related. So it's unlikely to see those things go astronomically through the roof and not see hospitalizations also increase. When I showed the curve of hospitalizations, it mirrors identically to the overall case count. They're just at a very different scale. So, and positivity is the driver for those. So as more and more people are sick and testing positive, but if people stop testing, we wouldn't have any positivity. So, and that very well could happen. People may stop testing, which we would encourage anyone who's symptomatic to still test because it's still important to prevent. The only outliers are really variants. And so that's the only other thing, but that would still drive hospitalizations. So again, that's what we're really going to be tracking. But they are.
As you said, we're not trying, the whole point of the public health orders was to spread out the disease, make sure people didn't get too sick, and to not overload our hospital system. So they're driving down to that one metric at this point, our community hospital system, to really kind of determine whether or not we can move on to this clear on May 16th.
Yeah, and the other metrics, it's not to say none of them have ever been important. They're all related. So they're help predict, as you're seeing increases in cases in your community and higher positivity rates, you're going to expect to see more people that are getting sick ultimately get hospitalized. So they're all have always been related, but ultimately the one that has been the biggest driver is what's happening within our healthcare system.
Okay, let's move back to the blue order. So what's going into effect tomorrow? The Boulder County order that's been put into effect that starts tomorrow, given the sunset of the state orders, still recognizes all the same practices under blue, the capacities and the practices. So if it says you need to, distance at a bar for 6 feet at a bar, you still need to distance 6 feet at the bar, correct?
6 feet is a driver regardless of sector. again, the exceptions are the ones that have been allowed to do it, for all of the dial iterations. So personal services, we know that those are delivered where you're not 6 feet of separation. Otherwise, all the other ones that have always needed 6 feet of separation, that's still needed. So really what the local dial is our current state 3.0 dial is now adopted at the local level. And then we've moved we're moving the county into blue. So that's really the only significant changes. And again, the state's intending to remove their state dial. So we now need that still in place for another month so we can get our population ideally 70+% vaccinated in the next month.
Until May 16th, do outdoor pools need to clean touch surfaces every hour as prescribed in the order until that period of time?
Yeah, anything that you were doing under the dial 3.0, again, for level blue, which some folks haven't been in blue, they've been in yellow. So there will be a little change for everyone. Otherwise, everything else that you were doing is still needed. You still need symptom checks. You still need those bathrooms cleaned, on a higher frequency and things like that.
And then on May 16th, it's probably not a best practice for us all to just to the floodgates to open. I mean, our community is going to be, and this is a question I got in an email. Our community is going to be, there are people in our community that are still fearful. There are people that are still worried about going out and doing things. So are there actions that Boulder County Public Health is taking in guidance for families, especially who have children that can't be vaccinated yet, when we move to a level clear, when there isn't 6-foot distancing, when there aren't some of these requirements? Are there going to be some support for families in those situations?
We would still encourage businesses to offer hours for people that are immunocompromised, high risk. I think those are still going to be good practices. Many of the things that have come to light in COVID are good practices any of the time. We have immunocompromised people before COVID was here, and we're going to have immunocompromised people after. We have plenty of diseases that those folks are higher risk for getting. So many of those practices hopefully just become staples of how businesses operate. Give people space, especially when we're in cold and flu season. These are all just good things that prevent disease in general. This was just a disease that affected the world in a whole different way than many of the other diseases that we are more accustomed to. But yes, I think all those kind of practices, doing a good job of hand hygiene, making sure you have soap and paper towels at all your hand washing stations, that you have access to those things. All those things are going to be good ideas. They just will not be part of public health orders for businesses. But anybody who's immunocompromised and you are unvaccinated, you are still at higher risk. So it is wise for you to take additional precautions, much like we've urged throughout the whole pandemic.
Some of the practices that happen under 5 stars, some of the additional cleaning practices, some of the additional signage, some of the additional, hand sanitizers, those types of things might create some of the optics necessary that you want to continue well into clear, because there are those items that help provide that safe component, that public health component, that people might feel a little bit more safe coming into your facility, even as we move to clear as well.
Yeah, again, the risks for the disease and many respiratory diseases is close contact with people and then those respiratory droplets. So none of that changes when we move to clear. So giving people space, staying home when you're sick, washing your hands, still doing masking indoors, all of those things are going to be valuable. And in fact, when we get back to flu season, we likely will still have COVID around. It's still wise to do a lot of those things. They really do impact the amount of disease. We did not see anywhere near the flu this last year, and it's because of all the protocols people were taking to prevent respiratory disease.
Does the current public health order define or recognize vulnerable populations as previous orders did, or is it just a recommendation?
So we're still in 3.0, and so that's important to know. So for the next month, it is basically the same orders that are in place. So there is no change until we get to May 16th, and the orders go away.
then at that point, what you're saying is on May 16th, it might be a good practice to still offer that to families,
Yes. We would,
older adults, immunocompromised, all those, to have those, if you had special hours or pickup or curbside. Honestly, there are some things I may not go back to. There are some things, it might just be a trend that continues in some of these practices that we've created. All right, so if we move to clear and we're in that trial period until August 16th, and our hospital, regardless of where our hospitalizations are, is there a chance we could move back to blue in that period of time or up the dial?
it would be based on that last metric I showed you of hospitalizations per day. If we go above 2, that's when we potentially could make a change for the issues with clear.
And can you remind people where they can track that hospitalization metric?
Yeah, I can post that in the chat.
So while you're doing that, we had some questions about 5-star that came in that I can answer. So yes, as soon as the administrative committee makes a decision, and as a reminder, the administrative committee is made up of a representative from each municipality, hospitals, public health, the county, chambers, economic development. We meet weekly. We will let the 5-star businesses that are currently operating in 5-star know immediately, and then any decision we make will be sent out in a communication that I send to the entire listserv as well. And then if there is any change to any of the guidance, for example, you're no longer having to take temperatures as a restaurant, or some of the checklist items, if we make any changes to any of those best practices and there's the required versus suggested, we'll also let the current 5-star and future 5-star businesses know about the changes to the checklist as well. So, there were some changes in the order that now there may be some changes to the checklist, that you're no longer required to do some of the items that were under the state 5-star. We're now at liberty as the administrative committee, and it was put into the public health order to allow the administrative committee to make some changes to some of those programs.
And I just wanted to make sure, here's some additional resources that may be of use to folks. I don't know if we've shared all of these in the past, but we post in that Denver Metro hospital admission rates. So that is a useful tool because you can see it based on whatever counties of concern, wherever you're located within the metro area. So you can just toggle between those check boxes for counties.
All right, so question about the gathering, the 10-person gathering. Thank you for that. So I will send those out. I took a picture of them, and they're also in the recording, but I will send those out into the email. So if like a museum or a place that hosts parties, do they have to limit it to 10 people or less? Is that considered a personal gathering, or is that considered an indoor event?
We leave a little bit of that latitude to your discretion. So if it's just a party, somebody's having a birthday party and they want to rent out your museum, that's likely a private gathering, versus the museum is hosting some kind of an event, then that can follow the indoor event guidance. So the lines are very blurred. So if it's an event, you need to follow all of the event requirements. So if it's a personal gathering where you're kind of doing your own thing, that's now limited to 10 people, and there's not as much structure around what you have to do requirement wise. So
okay,
and that's the best answer I can give, because it definitely, there's a point where it becomes an event and there's a point where it's still your personal private gathering. So to some degree, who's involved, how is it solicited? Is it open to the general public? That can help you lean one way or another, whether it's an event or not. But event is not defined in the public health orders anywhere, so it doesn't give a specificity of when it becomes an event and when it's a personal gathering.
Thank you. The person said thank you for the clarification. Is the state of Colorado still officially in a public health emergency, or has that expired or ended?
I would say yes. I think when the orders are sunsetted, I don't know if that still officially says the state is no longer, they're just no longer in the business of running the public health response, and it's at the local level, which a lot of it has been at the local level the whole time. So, so I don't know if the state will still consider themselves in a declaration of emergency or not.
Okay, let's go to shared equipment, pool tables, any of those types of things that are in bars or restaurants. Until now, let's talk April 16th to May 16th. We're still in dial 3.0. We're under blue during that time. What's the rule on pool tables at that time?
Those have been allowed under 3.0. I think casinos have been allowed. So it's really now those need to be cleaned. I believe the requirement is between patrons. So, so that those kind of common use are okay.
Okay. Buffets. So under blue in the buffets, is it still served to the person and no self-service for a buffet at this time? And then when we go to clear, are we going back to self-service?
It would. I mean, again, it's not a best practice. That's a risk outside of COVID, but until we're out of the dial, all those other dial requirements still remain for the next month.
Okay. All right. So I'm just getting through these emails. Apparently my email yesterday prompted a lot of questions. All right. So for the indoor, just a clarification for the indoor events numbers, you're no longer using the space calculator. You're using 6 foot distancing, 175, or the higher percentage, whichever's lower, but you're not using that indoor space calculator anymore, correct? Correct. Okay. Ooh, this is a really long question. I will ask, how about dance floors? Are there any guidance on dance floors right now and in the future? I mean, right now it's probably, using that indoor space calculator, especially making sure you have a lot of space around individuals, but afterwards still trying to maintain distance is probably a best practice.
Yeah, I mean, opening up dance floor and allowing everyone to dance, unless you can somehow ensure everybody remains 6 feet apart, which is not going to happen. The exceptions, there are some guidance for school proms that allow sort of pods for tracking case contact investigation through that. But outside of that, for a general facility to open up dance floors and allow people to dance, you're not going to be able to have social distancing. So I don't know that it's called out as a prohibited. You just have to have social distancing. So so those are just probably poor ideas because you're inevitably going to have that not happen.
So someone asked, I think it's the same person asked, is there going to be a new indoor space calculator to accommodate these new modified spacing restrictions? And the idea is, if people are seated, you maintain the 6 feet, and you can have them a little closer, so you can have a larger number. If they're unseated, you want to maintain distance, and you have a capacity number as well there. But the distance is that 6 feet again. You just have to go at your capacity numbers or the 175, whichever's lower, correct?
Right. And again, I think those other guides really are going to give you a very conservative way to do it. But again, as you're able to increase capacity a little bit to see that you're still able to socially distance, that is allowed.
Okay. And then outdoor events, right now, up until, we're going to clarify again, April 16th and May 16th, there's not really a limit. It's just that 6 feet distancing. But if you're deciding to have a large event over 500 people, you need to submit those plans to Boulder County Public Health.
Correct. Yep. To that business email, the COVID biz email.
That we all should have memorized because it's the last slide that we have up during question and answer every week. All right.
And it does say that I think it needs to be 14 days prior to your event.
Okay. Would the clear lucite shields or barriers still be required between customers and cashiers at outdoor craft or vendor events? Now, April 16th to May 16th, we're talking retail. Between that time, we're in dial 3.0 and we're still requiring the plexiglass shields. After that, you're not requiring shields at that point, right?
The piece that throws me there is saying outdoors. So I don't know if that outdoors plexiglass is required.
If that person could send me an email, that'd be great, and we can check on that and see if that's required.
Indoors cashiers, has been a requirement for retail, is having those plexiglass at the cashiers. But I know some people did move some of their purchasing outdoors, so they didn't have to deal with some of those pieces. So I don't know that is required outdoors, but it is indoors.
Okay, so we're talking about that personal gatherings. Does that restrict employers from having meetings of 10 employees or less? Or is that just more personal gathering?
Any work-related function, any sector that has a regulation under Dial 3.0, their activities fall under that sector. So this is strictly for personal. If it's related to your office and your office work, if it's related to your restaurant, if it's related to any of those, you fall under your sector guidance. We still would not encourage in person. We'd still encourage virtual. If you're going to meet, we would encourage it to be outside rather than inside. So
make sure you have enough space so that people can distance out. So if you have more than 10 people, it's got to be a pretty large space for them to be able to distance to 6 feet, wear masks. But that doesn't fall under the personal gathering order is what the question really is.
If it's part of your work function, again, whatever sector you're involved in, you would follow your sector specific guidelines. So this sounds like office to me, is having a meeting of your employees. So you would follow your office sector guidance.
At one point in the office, there was a limit to the number of people that could meet, which I think is where the confusion lies. Because at one point in the orders, because we've been through, I think, 150 iterations of these orders, there was a limit to the number of people that could meet in a meeting within office setting. The personal gathering is personal outside any of the industry sectors. Just think of it that way. If it's within your industry sector, follow the guidance within that, the distancing, masking, make sure you have enough space, cleaning, all of, temperature checks, all of the stuff that you have within your guidance under Dial 3.0 up until May 16th. And then there's recommended best practices.
Yeah, and I think the office sector, again, you're looking at a higher, I think it's 75% or whatever is your capacity, and that would be based on what space you have, so not the entire building. So if you have a large conference room, you're looking at 75% with your ability to have people socially distanced.
All right. While you're answering the next question, I'm going to put in the chat a link to the state order, which is the Dial 3.0. If you go to COVID-19 it's COVID-19 colorado.gov. If you go to guidance by sector, the order is actually well defined by sector in there as well. So you don't actually have to read the full order, but we'll put the link to the order in the chat for people to look at. So that you can see, because the Boulder County order doesn't go into the specific guidance. It's the same that's been in Dial 2.0, Dial 3.0, those types of things.
What I would say is that I'd still reference our order, because it does have the appendices that has all of the sectors broken out. So you will want to make sure that you're looking at that. But if you're trying to understand definitions and things like that, there might still be some utility at looking at the state. But hopefully our order does have everything that you need.
Okay, so what happens after the 90 days? Okay, August 16th. What does that look like?
I mean, we will likely continue on with no public health orders and probably not even a mask order at that point. But again, really just depends on what happens with the world of the virus. But I would expect we will not have any specific requirements.
So the state guidance has some allowances for people to take off masks if there is a certain number that are vaccinated. The Boulder County order doesn't allow that, correct? You took away some of those.
Yeah,
they took away some of those allowances. So the Boulder County order is if you're indoors, wear a mask.
correct. Yeah, I don't know how that will ever be determined. I don't know that people are going to wear their vaccination cards on their shirts or something to know how many you have. And one more comes in, one more goes out. Now everybody has to put masks back on. It doesn't make any sense.
Yeah, I have my vaccination card because I got my first one on Tuesday, and they're like, hold on to this. This is very important. It's like a passport, take a picture, have it everywhere. And I was just thinking about that the other day. So there's a question about quarantines and isolation. So there's a difference between the orders and best what you need to do when someone gets sick. If you're exposed to the virus, whether it's April 16th, May 16th, or June 16th, you're still going to quarantine, correct?
Correct. Yeah, we will still be in contact with sick individuals and still be doing contact tracing, case investigation work. So those people who are high risk contacts will still need to quarantine. So, and likely we'll be dealing with variants because that's typically what we'll be seeing as we move forward. We're concerned about the P1, the Brazilian variant. So that is present in Colorado and Boulder County. So it's very important that people who are sick do isolate and quarantine if you're a high risk exposure. You know, the exceptions can be fully vaccinated folks, except for possibly some of these new variants. So that still might need people to quarantine.
You just read the next question that came out. Do people that are vaccinated need to quarantine? And the answer is yes, no, unless they've been exposed to a variant.
Yeah, that will be something that will be determined by the case investigators. So, so that people don't expect that in every circumstance they will always be exempt from everything once they're vaccinated. Again, we have to track this disease very carefully and make sure it doesn't spread as it mutates.
So limited healthcare. Up until May 16th, they're still being asked whether they're limited healthcare, optometrists, non-surgical, personal services. They're still being asked to do, a virtual waiting room or take reservations when possible, taking temperatures. They still need to screen for COVID symptoms and exposure. They still need to log patients and guests when entering the building. They still need to follow all those protocols, correct?
Yeah, until May 16th.
Okay. And even then, it's probably not a bad thing to continue to ask, have you been exposed or have you been experiencing any symptoms before people coming in, because the COVID's still in our community.
Yeah.
It's not a requirement. It will be a best practice at that point.
Right. Yeah. Again, there's no reason that you would want sick people coming into your business. So I think screening for fevers and things like that is just should be a smart part of any healthcare setting, protocol to begin with.
Are there any other questions out there? I was just imagining getting the email from me on Tuesday where it was, Friday going to blue. If numbers stay well on May 16th, we're going to clear. And everybody's like, what's clear? Like just knowing what we've been through in the last year and all of the different changes and the requirements and tracking those and then going to clear. And I want to thank whoever came up with the clear, the color clear, because I know that's not a good thing for all the marketing posters, but at the same time, hopefully it defines what it is that I think you're trying to show, which is we're moving to this system where follow best practices, wear your mask if those orders are in place. There are certain sectors that may be regulated, but we're moving towards in the clear as far as regulations go. Yeah. You said that children's summer camps and childcare may have different guidance, correct? How and when will that information be available?
Yeah, I think for schools, I think there already is through the Colorado Department of Education. There already have a lot of information on how schools should be operating. And then I think that's the next piece that we're going to try to clarify on camps and childcare. So I don't have a definite timeline on that, but our certainly goal is to have that before we get to May 16th.
So when we move to clear, and there's, can you elaborate on what the mask mandates may mean for indoor spaces when people are eating and drinking and there's no 6-foot distance required?
It wouldn't be required. I expect similar to how restaurants are operating now, that when you are eating and drinking, you wouldn't need to wear a mask. So I would not expect anything more stringent to come out in any of our orders, but I would expect other times that a mask will likely happen through the summer, but through this August period. But that hasn't been established. That will happen next May 5th, I think, is when our current mask order is set to expire. So the board will reflect on that, and they will make a decision on whether they want to extend it all the way to August, or they want to only extend it a month. They only want to extend it 2 weeks. So that decision hasn't been made, and it will happen prior to that expiration in May.
Well, the current order is, when not eating and drinking, people should be wearing a mask, although it may not be the practice in all cases. That's currently how it is. And then restaurants are encouraged to have their staff stay as far away as possible from patrons that aren't wearing masks. Probably should continue, especially as tables move closer together. And I've heard from restaurants, you may not have the staffing to be able to move right away. And it's not probably good optics to, as of May 16th, have full capacity and, booming numbers in there that not everybody may not feel as comfortable. So we're going to see probably a phased reintroduction at some businesses, I've heard, but maybe closer together, more capacity on some nights, maybe not on other nights. So we'll see. But you May 5th is the next iteration of the mask order. So we'll figure out what that means then. That will overlap with the May 16th change. So that'll be a good indicator at that time. Any other questions? We're getting close to the top of the hour. If you have a major appointment to get your vaccination, do so. They're opening. I've seen a lot more people get in. I went in, took no time. It's great. Very well organized. Very well organized. Kudos to the vaccination teams out there. All right. Well, we will see everybody next week. We will continue these. We know there's still some questions. We'll probably have to continue up until May 16th and then figure out a new iteration or a timeline or a way for people to ask questions. 5-star, as soon as we have a decision, we'll let you know. Everybody else will let you know the 5-star decision as well, but the 5-star certified businesses will let know first. At that time, I hope people don't go through withdrawal. Somebody just wrote in the chat that they'll go through Corinne Lane withdrawal after May 16th. I'm going to go through Lane withdrawal. I've seen you every week for I don't know, a year now. At that time, we will see everybody, and hopefully everybody starts operating in blue tomorrow. See what happens. But Boulder County has an order. Sunset of the state order is supposed to happen. You can start operating in blue tomorrow. In some cases, that may not be a big change for you. In some cases, it may be. If you're a gym, that might be a big change for you. We've seen it with our 5-star businesses. So thank you, and have a wonderful, wonderful, wonderful weekend.
Thank you. Thanks, Corinne.